Start.
Should I start from the beginning or from there on?
Start from the beginning.
Okay. Hello. 1, 2, 3. Okay. Hello. This is Dr. Khan, one of the doctors in today's admission unit. May I confirm your name and age, please?
Hello, doctor. My name is Caroline Ridley, and I'm 30 years.
And how can I address you?
Please call me Caroline.
Caroline. Okay, Mrs. Caroline. Today we are here to discuss about your health condition, and during our conversation, I will take some notes, and our conversation will be confidential. Is it all right?
Okay, doctor, no problem.
So, Mrs. Caroline, can you tell me in details what is really bothering you?
Doctor, you know that I had cancer in my ovary, and I was diagnosed with it 5 years ago. After that, I was operated for this. And doctor at the time found that it has spread out, so they gave me a few cycles of chemotherapy, and I was on regular follow-up. But a few days ago, my doctor said that it has came back, and I may not respond to the previous chemotherapy medication. So they were trying to give me another type of medication, but they haven't started it yet. And for this, I am in their waiting list for new medication. But for last week, I have noticed, actually my husband said that I have become somewhat drowsier, and I have noticed that I feel sleepiness. Even I sleep in the daytime. That is unusual for me. And my husband said that I have become somewhat less attentive, because sometimes I don't hear to them. He said that I don't pay attention to his word. Sometimes I do some abnormal behavior. That is very unusual for me. So I visited my GP.
Okay, Mrs. Okay, continue.
So for this, I visited my GP, and he sent me here.
Okay, Mrs. Caroline, I understand that it's been very bothering for you. Can you tell me one thing in details? Like, you had a cancer, you told me that, and you underwent surgical procedure and then received some chemotherapy. And so, may I know that at the last time when you received chemotherapy, and did they told you that you are completely cured from cancer?
No, doctor, I didn't get any confirmation that I was completely cured from the cancer, but that as the cancer is spread out, so they gave me medication, chemotherapy.
Okay. Okay, and after that, what about your health condition? Did you feel well?
I was well, doctor. About 2 weeks ago, I felt some pain in my tummy, and then I visited my GP also, and he gave me some painkiller. That is some naproxen, paracetamol, and before that, I also have some pain, but for that, my cancer doctor gave me morphine.
Okay.
I am taking those. I am not taking the naproxen now.
All right. So, when did your doctor start morphine?
That was about a few weeks ago.
Okay. All right. And how often are you taking it now?
Okay, I am not taking currently for last 3 days, because I feel much drowsy when I take those.
Okay. And uh, it was started for your tummy pain, right?
Yes, doctor.
Okay, so Mrs. Caroline, may I know about your pain now? Do you have how much pain do you have?
Not so severe, doctor, but that is somewhat severe to bother me.
Okay, I'm really sorry to hear that. May I know what are the places you're having pain now?
All over the tummy.
All over the tummy. Anywhere other than your tummy?
No.
All right. And what about your bowel work? Is it okay now?
No, doctor, that is another issue because I am not passing bowel regularly. Previously, I passed my bowel about
Mhm,
once a daily or sometimes once
mhm,
every 2 days. But
mhm.
for last week, I am not pass. I have passed bowel only once.
Uh, okay. And uh, what about your water work?
I think that I am passing less water,
Less water. Okay. And for how long?
maybe for 1 week.
1 week. And before that, it was completely normal.
Yes, doctor, I can say that that was normal.
Okay. And can you tell me the amount? Did you measure
No,
in 24 hours duration?
no,
Okay. And do you have any other complaints like pain during passing water or
no,
something like that?
no,
Okay. And what about tummy? You have pain, your tummy pain. So do you have any tummy swelling along with pain?
yeah, yes, doctor. I have also noticed that my tummy is going is becoming somewhat bigger, and I thought that it is cancer again. But my cancer doctor said that
Mm-hmm.
there might be some fluid.
Mm-hmm. Uh, okay. All right. I'm really sorry to hear that. Uh, uh, and did anyone remove any water from your tummy
No,
or
but
took any
my
water?
cancer doctor said that I may need to remove water.
Okay. Okay. And what about your appetite?
That is also the doctor I lost because I cannot eat much like before.
And for how long?
For last 1 week, I noticed that all the problems
Okay.
came.
And did you notice any difficulty in swallowing food?
No,
Okay. Any feeling of sickness, nausea?
I sometimes I feel that, and also I have vomited 2 times.
Okay. 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 And what about the content of your vomiting?
That was usual food. I cannot say that that
Okay.
was
Have you
totally
noticed any
food.
blood with it?
No,
Okay. And all right. And as you have mentioned, you have tummy swelling. Do you have any swelling in any other parts of your body?
no,
Okay. Okay. Any lumps and bumps in anywhere in your body?
no,
Okay. Have you noticed any high body temperature over the time?
no,
All right. And what about cough?
no. I don't have any cough.
Any cough?
No,
Okay. Any breathing difficulties?
no,
Okay. Any pain in your chest?
no.
All right. And what about your weight?
Sure, doctor. I cannot eat much, but I gained weight. That is surprising thing.
Okay. Okay. And what about particular weakness? Do you have weakness in any part of your body?
No, not any part, but I generally I am feel weak.
Weak. And for how long?
For 1 week,
And is it increasing gradually?
yes, doctor.
Okay. And do you feel this thing weakness all the time or any particular time, like
No,
morning,
no, doctor.
evening?
All the time, even I cannot take care of my children.
Okay. Okay. so you need to take rest. So
Yes,
can you perform your daily activities, like I can say going to
I can
outside
manage
for
somehow,
shopping?
but I cannot go outside. But I can manage my work somehow. But that is becoming very much difficult for me. I even cannot feed my child.
Okay, so can you do your personal work, like going to toilet or wearing clothes?
Yes, doctor, I can do, but that also I also feel weakness during those.
Uh, okay, I'm really sorry to hear that. Okay, do you have you noticed any problem in your vision?
No,
Okay, and any headache?
no,
Okay, any stiffness of your neck?
no.
Okay, any shakiness in any parts of your body?
Yes, doctor. I noticed that I have some shakiness in my hands, and I have noticed it twice.
Okay, and is it both of your hands or just one hand?
No, doctor, on hands.
And is it there for all the time or any particular time?
No, that wasn't something particular, but I was drinking some water. At that time, I noticed that I feeling shakiness of my hand.
Okay, yeah, okay, all right. And have you noticed this shakiness in your rest, or whenever you touch or go for something and you notice it?
Just two times, doctor. I haven't noticed so well.
And when did it start first?
3 days ago, that lasted for only a few seconds.
Okay, and what about your mood?
Generally, I didn't find anything abnormal.
Okay, okay, all right. And uh, so currently you're staying in your house. May I know with whom you're living?
My husband and my children.
Okay, and are you happy with your companion or need
Yes,
any
doctor.
support?
They are very supportive to me.
Okay, so may I know any other medical condition you're having?
No,
Okay, may I know about any pain in your back?
no,
Okay, about the pain in your joints?
no.
Okay, and may I know what are the drugs you are taking now?
Yes, doctor. For pain, I am taking paracetamol. I took naproxen, but I am not taking it currently. And I take
Mhm.
morphine solution and also morphinima. But I am not taking morphine solution for
Okay, and
3 days because I feel drowsy after taking those.
all right, and is it has it improved a bit of your drowsiness for the last 3 days?
Somewhat, doctor.
Somewhat. Okay, so not much.
No,
Okay, okay, Mrs. Caroline. May I know about your personal habits? Like, do you smoke
no, doctor, never.
now? Okay, that's good. And did you drink alcohol recently or
No,
previously? Okay, okay, all right. And currently, as if you're 2 weeks, may I know whether you go for any driving or can you able to do this?
no, doctor, I don't go out.
Okay, Mrs. Caroline. Uh, do you want to address me any other issues now?
No, doctor, this is so far.
Okay, so uh, Mrs. Caroline, have you noticed any of the family members having same issues?
Yes, doctor. My mother had also died of ovarian cancer, and my aunt was diagnosed with ovarian cancer, but luckily she was operated earlier age. And we were undergone by genetic testing and find that we have some problem in our gene.
Okay, and can you please name the problem or any of the doctors told you about it?
They said something BRCA gene.
Okay, and you're the carrier. And did you go for this genetic test?
Yes, doctor, I was positive also.
Okay, I'm really sorry to hear that. And all right, Mrs. Caroline Riley. So, as I want to summarize all our discussions that happened till now, that
Means meaning.
you came to the clinic with the complaints of some drowsiness, along with your tummy swelling and pain in your tummy, and you have also complained about some difficulty in bowel work, such as you're going to the toilet less frequently than previously. You have also gaining some weight, also loss of appetite as well. Right?
Yes, doctor.
Okay, along with this, do you want to add any other further things?
No.
Okay, okay. And so what are your concern?
Doctor, did my cancer went to my brain, because I heard that involvement of brain produces such type of symptom.
Okay, Mrs. Caroline, it's very difficult to give this answer right now, as I didn't examine you and also yet to do any kind of investigations. But based on your history, I can say it may be a possibility, but we are thinking that perhaps maybe your drugs, your morphine you are taking, which may cause you this problem. And sometimes cancer may go to different parts of the body, including our bones, and that may cause one of the components called calcium that may rise in our body and may also cause this problem as well. And regarding your brain, I can say it may be a possibility, but to be more precise, I need to do an imaging test to confirm that it is not there.
Doctor, you also said that my
Are you
drug
getting
can
me?
cause this, but I am. You said that my drug caused this, but I was taking drug for last 5 weeks, that morphine,
Mhm,
but that
mhm.
didn't do it before. Why it is causing for the last week only?
Uh, Actually, sometimes it happened that our uh, cancer deteriorates sometimes more rapidly, and again, it
I'm
may be a possibility that you have told that your urine output is reduced. So maybe that is the cause of getting more side effect from your morphine tablet. Any other questions?
Am I going to die very in a short time?
Okay, so at this point it's very difficult to answer that. It is very short, but based on on observations, I need to say maybe we need to wait, and we just cannot answer the exact moment. But I can say their cancer is very advanced, and
Okay. What is your differential diagnosis for this lady?
okay, so for this lady presented with the complaints of drowsiness and
What is
along
your
with.
differential diagnosis?
Okay, so my first differential will be the side effect of morphine metastatic, which is mainly due to his recent renal issues, as this patient also complained of reduced urine output. And my second differential is metastatic cancer causing hypercalcemia. And my third differential is uh, brain metastasis, which may cause his drowsiness.
Okay, how will you investigate her?
So for this lady, I will check for complete blood count with ESR to check for any signs of infections, and I will also do liver function tests to see any kind of derangements, and I will check urea, electrolytes, creatinine, and along with the routine urine examinations. And I'll also check for serum calcium, phosphate, and serum albumin level. And I will, for brain, I will check a brain MRI to look for evidence of metastasis. And for ovarian abdomen, I will better to go for an abdominal ultrasound examinations. And along with, I will also consider a chest X-ray as well.
Okay, how will you manage that?
Okay, so at this patient, first of all, I will admit this patient and start IV fluid and also check start IV fluid, and I will also involve different multidisciplinary team, including pain and palliative care physicians. I'll also involve nephrologist, medical oncologist as well. And along with that, I will also consult a psychiatrist for dealing with his mood.
Okay, for this lady, what could be the cause of such rapid deterioration of renal function?
So as I am suspecting that this may be a post renal cause, there's two possibilities in my mind. First of all, that cancer, metastatic cancer may compress, obstruct the urine outflow, that may cause reduced urine output and impaired renal function. And secondly, the patient may have vascular compromise, as the excessive extravasation of blood may cause reduced renal perfusion and impairment of renal function. And thirdly, the patients may also can be septic, infectious, as this patient is taking chemotherapy recently. So I may consider some infection related renal issues. And fourthly, I'll also consider any probable medication side effect, as this patient takes naproxen, so which may be one of the possibilities.
Do you think any medication should be reviewed and stopped for this patient?
Yes, this patient, for this patient, I will surely currently stop naproxen and and this patient isn't taking any opioids, so I'll stop naproxen first.
Okay. For this case, I think you have done very well. In the personal history, I cannot remember that if you have asked about travel history or driving.
I didn't cover travel history, but did cover driving.
Okay, it's fine. Okay. Anything from Pinac?
Hello, Acha. Hello. Okay,
Yes.
recording stopped.
No.
Okay. I think, is it over, the discussion?
Yes.
Okay, so can you just stop the recording?